I want to thank the organisers very much for this invitation. VRP Teamnan particularly asked me to speak on this topic of the older carer because it's a theme that emerged in some research I was doing. I have to say that when I started the research, I hadn't anticipated that. My research interest was in looking at the balance between acute hospital care and long-term and community care in Ireland and in other countries in order to see how better we might compare what we do and what happens in other countries and how different systems of care may affect international comparisons of what we invest in health. But more and more, as I researched this, I came to realise that you really cannot look at any single part of caring separately from any other with full understanding, and that in this balance of care, the bits we don't pay for are as much, if not more important than the bits we do pay for. And more I found myself becoming interested in the effects on countries' healthcare systems of things like rising female labour force participation, and then the really subtle, interesting effect of ageing, not just as adding to the demand for care, but as adding to the supply of care, and hence the older carer. In journalism, where I worked for many years, they say a picture is worth 1,000 words. So I start with this picture, which is Iris Murdoch, a novelist whose work I enjoyed for a very long time, and therefore I read with interest her husband John Bailey's account of their lives together and of her later years when she succumbed to Alzheimer's. It was a controversial book because some of her friends felt it was disloyal of her husband to have written about this time. I have to say, when I came to think about this theme, though, it came back to me because it's a very powerful and moving book about the reality of a couple living together when one of them has this condition. This is amongst the things John Bailey writes, and he some of it has a diary of their days together, and he's hard on himself in it. Iris remains her old self in many ways. The power of concentration has gone, along with the ability to form coherent sentences and to remember where she is or has been. She does not know she has written 27 remarkable novels, as well as her books on philosophy. The old gentleness remains. It's a loving portrait. Iris's fear of other people, if I am not there, is so piteous that I cannot bring myself to arrange for carers. All that will have to come. After 40 years of taking marriage for granted, this new marriage needs us absolutely just as we need it. So even though it's a controversial book, I think more than all the figures that we use to discuss caring, it conveys the essence of caring and the dilemmas of caring for someone whom you've loved for a long time. Well, that's John Bailey and Iris Murdoch there. Who does the caring? Primarily in this talk, I'm going to be using official statistics from the Republic of Ireland, and in the version which will be on the website, the source will be at the bottom. In fact, it is. Well done. The source is at the bottom there, so you'll see where it comes from. I love the census of population because in the census of population, it's not a survey, it's everybody, or in theory, it's everybody. So when we discover from the 2006 census that 174 men aged 85 and over were providing 43 or more hours care each week to relatives and friends with illness or disability, we know that somebody ticked a box in 174 cases to say that that was the case. And that there were over 4,500 men aged 70 and over providing some caring, and nearly 3,000 of those were providing 15 or more hours care weekly. And what about the women? Well, in 2006, there were, of course, more women because women live longer. 246 women aged 85 and over providing 43 or more hours care each week. 6,700 aged 70 and over providing some caring, 4,400 of them 15 or more hours care weekly. And anybody who's interested in this, you can just go into the Central Statistics Office website and you can look under any heading, any age, and see precisely what people reported they were doing. And I think what's really useful about this, the census, is the level of detail, because I think it's already been clear from the talks earlier on today, is that aggregating everybody aged 65 and over together is very misleading in modern aging, because to be 65 today is not to be old. And indeed, for many people to be 80 today is not to be old. And it is very useful to be able to look at these gradations. What else did we know about who was caring? Well, I did this sum because I thought it was interesting in the context of a study I was doing looking at the need for long-term care. If you added up the men and women aged 80 and over who were providing 29 or more hours care a week, well, you could say there were 1,600 of them. If those 1,600 had not been available, were unable to do it, and if you were to assume that everybody they cared for was older, well, and all those people had to instead to go into residential care, that would have been a 7% increase in people in residential care in the Republic. So you can see what a big contribution that is just from that small group of people. Now, one of the things we didn't know from the census is for whom the older carers were caring. But I'll come on to that in a moment because thankfully we have another source now. In percentage terms from the census, this is what we discovered. Let me see if I can work this. There we go. So there, age 65 to 69, 6% of women were providing care, 4% of men. And there's a gradient down. If you look at this is the age of the carer, and this is the percentage in that age group in the population as a whole giving care. When you get to 85 and older, even though it's fewer in number, there are proportionately more men. And that's because there are fewer men relative to the numbers of women. So therefore, there are higher odds that a proportion of those men, a higher proportion of those men are likely to be with a spouse who needs care. The very recently published source, which adds to that picture, is it was published in July. Again, the Central Statistics Office in the Republic, they do a household survey every quarter, and this was the one that they did in third quarter of 2009. And it's a big sample. They go to a lot of households, they ask a lot of detailed questions, and this is where we get things like employment figures, for instance. But what they do from time to time is they add on questions on a particular topic, and this one they called the caring module. And this is what they asked. May I just check, is there anyone living with you, not living with you, who is sick, disabled or elderly, whom you look after or give special help to other than in a professional or paid capacity? And then they gave these examples. And what was interesting about this was it was a slightly wider definition of caring than in the census, and it came up with a higher proportion of the population that were engaged in caring. So whereas the census just asked about unpaid personal help, this survey asked as well about looking after and giving special help to. And they found that in the population as a whole, 10% of women said yes and 6% of men. This was 8% overall, if you combined women and men, compared to under 5% in the census. So the wider definition took in more people. The biggest, if you like, age category, the age category that contributed most proportionately to caring were the age category 45 to 64-year-old, where 13% of people said they were carers. That's about 1 in 8. But the next biggest percentage was the over 65s. Now, unfortunately, because of sample size, in this, all the people aged 65 and over are aggregated, which is a shame. It may be possible, by asking, this is what they've published, it may be possible they can provide more detail if somebody asks. In any event, the survey found that 8% of people aged 65 and over were carers. That meant that 1 in 7 of carers nationally were aged 65 and over. So that's pretty substantial, really. And they were able to give, in this survey, quite a lot of detail. And for the first time, we know who was caring for whom, which is really interesting to know. Now, I said they only surveyed 21,500 households. What they did do then is, because they know how their survey represents the population as a whole, they can gross up to say what different segments of it represent. So from knowing that, if you like, a certain proportion of people aged 65 and over were carers, they could calculate or estimate that represented 38,000 carers aged 65 and over in the population as a whole. And of those, you see it there, 2 out of 5 were caring for their spouse. Excuse me, just over 1 in 10 were caring for a brother or sister, and 1 in 8 were caring for a son or daughter. And as you see there, there's a sizable group that are actually caring for a non-relative. But remember, this includes give special help too, and there is detail in the survey about the kind of help. So for instance, if you were the sort of person who was handy and who was going to fix things or going to help somebody with their tax returns, that might come under special help. So the question is, who was doing the really intense caring? 21,000 of that 38,000 were caring for someone in the same household. 17,000 were caring for someone elsewhere. And that, all the evidence is that that care is the really intense care, the very demanding care. These were figures for not just the carers aged 65 and over, but all the carers in that survey. But they found that across all the carers in the country, those in the same household, half of them were caring for 57 or more hours a week. Excuse me. In other words, it was a full-time job, more than a full-time job, in fact. And over half were the person's only carer. And you can see there from the kinds of things that they were doing that it's very intense care. It's caring with medication, with physical care, with personal care. It's care for people with quite high care needs. So how are the older carers themselves? This was something the survey asked. Well, on a positive note, 2/3 of them said their health was good or very good. But 1 in 20 of the carers said it was bad or very bad. Nearly 3/4 had no disabilities, but 1 in 6 had difficulty with basic physical activities. And then 2%, respectively, had impaired vision or hearing, or difficulty with learning, remembering, and concentrating. And I think this is particularly interesting, that very last one, because I think something that many of us will be familiar with in our own lives is couples who care for one another. And I don't think anybody's got at that yet in surveys in Ireland, where perhaps you might have one person who's physically frail and another person whose memory isn't great. And one person's doing the remembering and the other person is the person who's cooking the meals. And you know, maybe the 2% with difficulty with learning, remembering, and concentrating, perhaps their spouse would say, well, I'm doing some of the caring as well. Oops, I beg your pardon. So how does caring affect carers? This again is for the whole group, not just the people aged 65 and over. Worryingly, 2 out of 5 are feeling completely overwhelmed. Half have disturbed sleep. 2 out of 5 going through an emotional adjustment. 1/3 finding some of their loved ones' behaviour upsetting, and 2 out of 5 upset to see changes in the person for whom they care. I thought about this information earlier on when I was listening to James Nasri's very interesting talk this morning, because it seemed to me, when he showed that slide which showed that the kinds of activity that add to people's quality of life, and that caring for somebody in your own home may not be one of those things. Well, yeah, it may be an occupation which is deeply upsetting, but nobody asked the same group of people, yes, it's deeply upsetting, but would you not do it? Or would you look back in a few years' time and perhaps your loved one had died and wish you had if you hadn't? You know, I think those would be interesting questions. Your quality of life may not be great right now. You probably would like a lot more support, but would you have chosen not to do what you're doing? You know, and I know what Iris Murdoch's husband, John Bailey, would say. Well, you saw his view. So this is yet another interesting source which has become available to us in the last year. In 2006, in the census, after questions were asked about the national instance of disability, the CSO then went and did a further survey looking in detail at a subsection that they selected of the people who had said they had disabilities to get a drill down and get a lot more information. about their lives and their care. And in the last, in January, in fact, the second volume of their results was published. And this gave things information on how people with disabilities of all ages were receiving care, and also where they felt they needed more care which wasn't being met. And I think what's interesting, just and relevant to this theme, the theme of the older carer, care by families, is this question of intensity of care. If you look here, you'll see that the biggest source of care for people with disabilities, the largest bar, is family living in. But even more significantly, the darkest part of any of the bars is care that's been given throughout the day. So if you contrast family living in giving care, their availability for care, if you will, throughout the day, compared to, for instance, well, a public health nurse. Nobody expects a public health nurse to give care throughout the day. They come, they visit periodically, and the public health nurse would visit weekly or less often. So you can see that in terms of where care comes from, the greatest intensity of care is from family living in. And for instance, in the National Disability Survey, it's important to be clear that they don't distinguish between a younger person with a disability and an older person who's acquired a disability because of conditions that are associated with aging. So they see it as a continuous spectrum. So, an interesting question, how much care is unpaid? This is a pie diagram that I put together myself. I'll explain how in a moment, from various sources, but to try and get a handle on that. This is the overall pie. The full pie is the population with severe disability aged 65 and over in the Republic of Ireland. So of the population with severe disability, age 65 and over, about 20% have some severe disability or multiple disabilities, but something which severely affects their ability to participate in daily living, and that's according to the National Disability Survey. So I put that information together with an estimate of the proportion of people in residential care in 2006, in the same year, who were aged 65 and over. So that's that brown slice of the pie. And then from figures from the HSE, I was able to calculate the proportion of people who were receiving home help services. Now that's not broken down by age, that's an overestimate because it includes people aged under 65, but it was the best I could do. And the average, as you see there, was 4.7 hours weekly. So some would be people be getting more, some would be getting less. It's not a lot. But even if you count those as older people with severe disability receiving care, it leaves you with, with that slice there. That's at least 25,000 people in private households in the Republic in 2006 with severe levels of disability who weren't receiving formal care. And we know who is caring for them. We know it is the carers. So how many people need care and cannot get care? Again, the second volume of the National Disability Survey had questions about, do you have needs for care under various headings that haven't been met? And I've looked at, and here there was a gradation in age. So I could look at people aged 75 and over. Nearly 58,000 people, of whom 13,000 were receiving some service. Now, these are not people who said they had severe disability. They had some disability. Some of them may have felt they had no need for care. But there were 6,000, over 6,000, who said they needed services that they couldn't get. And interestingly, respite care was the greatest need. And I think that's not surprising when you put that together with the picture of carers caring those long hours at home for their relations, and may be very happy to be doing it, but you could see how they might need, with disturbed sleep, 57 hours a week, they need respite care. So it's not surprising. In fact, if anything, it's surprising that the figure isn't higher. 1,500 couldn't afford the service, 1,250 were on a waiting list, 1,500 it wasn't available in their area, and over 2,000 didn't know whom to contact. And I suspect if you were to go to people and say, you know, in other countries they do X, Y, and Z, would you be interested in that? Do you think you have a need for it? You might see those numbers coming up. So, other countries. How much formal care would we need to match other countries? And just one apology on this slide, that date is, my fault, is wrong. That should be 2021. So this was from a report which is referenced at the bottom, which was looking at demand for the effect of demographic change on demand for delivery of health and social care services in Ireland in 2021. And I was working on the long-term care aspect of that. And one of the things I tried to do was to say, if we were to look at anticipated growth in numbers of people of older ages, say over the 15 years from 2006 to 2021 in Ireland, and to look at the kinds of care delivery we have right now, and to say, well, we would like to have the sort of services that are in various other countries, what would we need to do? And so this at the bottom, this graph shows the model in a number of different countries, and this shows the factor by which the care would need to be increased. So in other words, what you can see here is that this first bar is the increase in residents in long-term care to be like that country, the increase in home help recipients, or the increase in home help hours. In Denmark, there's a high emphasis on community care. So to be like the Danes, we would have to, well, actually nearly quadruple the amount of community care, the amount of home help hours on offer to be where they are for the population, relative to the population of older age that we expect to have in 2021. If it was the Norwegian model, well, our emphasis would be like this, but we'd be needing to do something similar with residential care. In all countries and in all models, with the exception of Germany, which I'll come to in a minute, we would need substantial increases really across the board. In the case of Germany, there would be proportionately fewer home help recipients, but what you need to know about Germany is that they have a social insurance system which pays people directly to, if you like, purchase their care at home, even reimbursement family members. So it's quite a different model, plus they have, by a large measure, the greatest number of hospital beds. So if you like, their model of care is different. So, interesting question. How many of us will be older carers or in need of care? How great a need is it going to be? Well, one of the really positive things that has happened really quite recently in the last decade is a substantial improvement in male life expectancy in Ireland. And it's also been happening internationally, but it's quite dramatic in Ireland. And the implication of that is that couples will live longer lives together. The gender gap in life expectancy, you can see there, has in quite a short period dropped markedly. So it's 4.8 years now, as compared to, say, 5.7 in 1986, 5.2 in only 2002. And it's interesting, you can see the effect of that already. Look at men and women living alone. There was a sort of steady increase, 1986, 91, 96. This is from the census of population of those years. It flattened out between 2002 and 2006. Increased male life expectancy means more people living together to a later age. And I get to it in a moment, provided we don't all divorce one another. The percentage by which numbers of women are expected to exceed numbers of men. Now in this, I'm using the figures produced by the demographer Edgar Morgenroth, who was forecasting, based on recent trends in life expectancy, what the numbers of men and women of older ages, these ages, were likely to be out in 2021. And what I've done in this is just looked at them as a percentage of one another. So where the line is high, it means that the numbers of women greatly exceed the numbers of men. Down here, see the red line? Well, that's men and women aged 65 to 69. Numbers actually about the same. What you can see is age 70 to 74, it'll have converged. Age 75 to 79, close to convergence. What the top line, aged 85 and over, translates into is that whereas in 2006 there were 5 women, say, more or less, between 4 and 5 women for every 2 men, by 2021 there'll be 3 women for every 2 men. So that's a big change. This is a study that was done in Germany where they have very good data. And they found that single people were 6 times more likely to go into residential long-term care than the married. Widowed were not quite twice as likely as the married. Divorced were 5 times more likely than the married. So what's happening to household composition in Ireland? What is the position? Okay, if you look at this, the light blue line is single people. Historically in Ireland, and going all the way back to the famine, we've had, if you like, the bachelor farmer syndrome, the person who never married. And that meant that even in our very oldest, at this point, there would be quite a high proportion of people who never married. That won't be the case in 20 years' time, because if you look here, the proportions of single people are much lower. All these categories here are people who have been married at some point. So the dark blue is married, green is separated and divorced, and brown is widowed. As life expectancies converge, you will expect to have much less brown out here, so much more still married. Because of the other trends, much fewer single. What we don't know, of course, is how many will be separated and divorced. And we haven't had divorce long enough to be able to predict trends. But the odds are there will be a lot more older carers. Again, on the bright side, disability rates are falling. James Nasru showed us the international trends this morning, and that's the case in Ireland too. Some of you who were here last year might remember I presented a paper on this last year. But the evidence is there again from the census of population that disability rates are falling in the Republic. So, back to the question, how many of us will be older carers or in need of care? I would say there's high odds most of us will, or many of us, will be both. At one stage one and at one stage the other. Which is why none of us can detach ourselves from either sides of this dilemma. So, again, that same study looking at Ireland in 2021. This is the population aged 65 and over in 2006. This is the forecast population in 2021. This is people with severe disability. A higher number, but a lower percentage because disability rates are falling. If the proportion of the people with severe disability in residential care and receiving home health care were the same in 2021 as now, that's what it would look like. This gap between that step and that step, and that step and that step, is care needs being met informally if things remain the same. And that's very substantial. So, what's happening around us? Well, a lot of bad things are happening around us, we know that. And this was from the Irish Times just a month ago. A crisis in care for people with Alzheimer's, people like Iris Murdoch. And you may notice home care, day care, these are the kind of things that were needed. Not all residential care by any manner of means, so these are people being cared for at home informally. And this is my second last slide, you'll be glad to hear. Back to my original interest that got me here to looking at the older carer. When I've been analysing international evidence on the balance of care, a few interesting trends have come out. It's very clear that as more younger women work, that demand for formal long-term care rises. You can graph that very easily across countries. But what's very interesting is if you look at convergence in life expectancies between men and women, even when you control for lots of other things like age and relative wealth of countries, you control for labour force participation by women, mortality rates, you find that when life expectancies of men and women converge, demand for both formal long-term care and acute hospital care is lower. And this is measures of utilisation, like numbers of hospital bed days per capita. And so that leads me to a conclusion that, not only is the role of informal care very, very important in this balance, but the role of older carers for one another appears to be critical. Now, it may be that convergence in life expectancies is capturing something else, which could be perhaps, and these are sort of topics that have been covered through today and will be tomorrow, things like less loneliness, less depression, more stimulation, better mental health, not just care for one another in the very, if you like, formal dependency sense, but care for one another in the sense of living together as a functioning couple who can live more full lives than they would on their own. So, which leads me to my final slide. It's clear that the older carer plays an enormously important role, which could do with better support. Thank you.